We begin with questions to the Secretary of State for Education. I will first call Secretary Gavin Williamson to answer the substantive question tabled by Julian Sturdy. Secretary of State.
Thank you, Mr. Speaker. And with permission, Mr. Speaker, I'll answer questions 1, 2, 3, 4, 5 and 6 together. I am determined to help learning continue in these challenging times. We have committed over £100 million to provide devices and internet access to vulnerable children, published a list of high-quality online educational resources, and continue to support parents and teachers in supporting children at home.
We go over to Julian Sturdy. Julian Sturdy.
Thank you, Mr. Speaker. Head teachers in York have told me of their frustration that they'll have to wait at least another month until they can provide students with laptops under the government scheme. So, Mr. Speaker, can I ask my right honourable friend what assurances he can give me that support is going to be available to schools in the meantime to help their most disadvantaged students to learn from home?
Secretary of State.
Well, as I'm sure my honourable friend will understand, the investment of £100 million in terms of both computers and other support for schools is a major investment, and it does take a while for these resources to be able to arrive at schools. We've already notified multi-academy trusts and local authorities as to what resources they'll be getting. We continue to work to provide as much resource, even with the BBC providing it into the homes of children right across the country.
We now go across to Amber Valley. Nigel Mills. Come on in, Nigel Mills.
Thank you. Parents across Amber Valley have been doing a fantastic job supporting their children continuing to learn while their schools are closed. Will my right honourable friend join me in thanking them? Can you set out what more we can do to support them to help their children continue to learn?
Secretary of State.
I'd very much like to join my honourable friend in thanking the teachers and all those support staff who've done so much in terms of supporting home learning, but also making sure that schools remain open for those children of critical workers and those most vulnerable children. We've seen the launch of the ARC National Academy, which is providing educational resources for children of all ages to support them in their learning. And we're looking at putting more and more resources online to help schools, but most importantly, help children to continue to learn.
We go across to Brendan Clark-Smith. Brendan Clark-Smith.
Thank you, Mr. Speaker, and I very much welcome the funding for IT equipment, as there's nothing worse than when a computer says no. Can my right honourable friend confirm that the laptops and tablets provided to disadvantaged and vulnerable young people will not just benefit them while the schools are closed, but will continue to be used by their schools to aid learning in the future?
Secretary of State.
My honourable friend, the member for Bassett Law, is absolutely right in his analysis. This isn't just about helping children during this crisis. It's about actually helping and supporting children for many, many months and years to come, making sure that schools continue to have that resource and help many children using that resource over a long period of time. We recognise a lot of work needs to be done to support children as they catch up on what they've missed, because there is no substitute for a child being in a classroom learning directly from a teacher.
We go across to Lee Anderson. Lee Anderson.
Thank you, Mr. Speaker. School closures will, of course, affect children of all ages and backgrounds in different ways. So children from more disadvantaged backgrounds are much less likely to have access to the internet via a mobile or a tablet. Will the Minister confirm devices with internet access are being sent to these disadvantaged children so they are able to learn online more easily? This would certainly help and ensure that the disadvantaged children in my constituency of Ashworth and Eastwood, where the Minister visited recently, are not further disadvantaged by this crisis.
Secretary of State.
Well, I had a great privilege of joining my honourable friend visiting Leamington Primary School in his constituency and seeing the amazing work that was being done in that school. This is why we've made a substantial investment, not just in terms of laptops, but also in terms of 4G routers, to make sure that families have better access to the internet and are able to make sure that their children are able to benefit from the brilliant resources, many of which have been made available for free by many people and many companies and organisations in order to allow children continue to learn.
We'll go across to Fleet Drummond. Fleet Drummond.
Thank you, Mr. Speaker. Would my right honourable friend join with me in congratulating schools in Hampshire for their success in ensuring that 31% of vulnerable children are attending school? And would he join with me to thank all the teachers, school staff and children, particularly those in the Mearn Valley, for their hard work both in school and home? And has the Secretary of State an indication of the impact of mental health on children and young people during the coronavirus crisis?
Secretary of State, I think you got the gist of
Thank you, Mr. Speaker. I'd very much like to join my honourable friend thanking the teachers, the support staff, the social workers, Hampshire County Council, all those who've been involved in making sure that schools are still open and available for those vulnerable children, and the amazing work they've done. And the rates that she highlights are truly outstanding. And we have seen a doubling in the number of vulnerable children who are attending school since the Easter holidays. And that's been down to the work of teachers, school staff and social workers reaching out to them and encouraging them to come into school. The honourable member raises an important issue of mental health. This is why we've committed £5 million worth of funding supporting charities to help children with mental health sort of concerns and issues, to help them while they're at home.
We go across to James Cartledge. James Cartledge.
Thank you, Mr. Speaker. Of course, while schools are closed, the issues around homeschool transport have effectively been paused for my constituents, but they will come eventually. And it will result, for example, in siblings potentially being separated and having to go to separate schools. Now, while this is a county council matter, the government actually issued its own consultation on homeschool transport last October. 5 Suffolk MPs, including myself, wrote to the government asking if they would consider changing guidelines so that siblings should not be separated by changes to school transport policy. I wonder if he's had time to consider that, and we'll be publishing a response soon.
I thank my honourable friend for raising this. The consultation closed in October of last year. Obviously, we were hit by the twin issues of PERDA being imposed, and obviously, as my honourable friend I'm sure will appreciate, the principal focus is on dealing with the coronavirus at present. But this is something that we do hope to respond to in the near future, but I'm afraid currently I'm not in a position to be able to give him an exact date as to when that will be.
We're across to the new Shadow Secretary of State for Education, Rebecca Longdale.
Thank you, Mr. Speaker. Constant speculation on when schools will reopen and whether it's safe to do so is leaving many parents, pupils and staff anxious. Last week it was reported the government was looking at best practice in other countries. This weekend it was reported that the government would reopen schools for Year 6 pupils on the 1st of June. And last night it was reported that there were discussions in government about giving schools and multi-academy trusts the flexibility to decide for themselves, amid concerns that ministers were coming under pressure to help kickstart the economy. I'm sure the Secretary will want to reassure parents, pupils and staff that their safety is the government's #1 priority. So will he clarify on what basis the government is making decisions in relation to school and college opening, and where will he make the scientific advice supporting his strategy publicly available?
State.
Well, if I can take the opportunity of congratulating the Honourable Lady on her new appointment, and I very much appreciate the time that she has made available in order to be able to speak with myself, and I hope that the regular briefings that we're providing her from officials are also of considerable assistance, as I think they were to her predecessor. In terms of sage advice, all sage advice is made public, and that's certainly what we'll be doing. But in terms of the return of schools, obviously I'm I'm sure shares with me a desire to see children being an opportunity of returning to school when it is the right time to do so, and this will be based on the scientific and medical advice that we receive. I can assure her is that we will take a phased approach in terms of reopening schools, and we will always aim to give schools, parents and of course critically importantly children the maximum amount of notice in terms of when this is going to happen.
Rebecca Long-Bailey.
I thank the Secretary for his kind comments, and he must understand that faith that children and staff are safe will be necessary for parents to have confidence to send their children to school. But nearly 1 million pupils in English schools are in classes of 31 or more, an increase of 28% since 2010. So there's understandable concern that social distancing will be difficult in schools. Everyone wants to see a return to vital education, to support pupils and to stop the ever-widening attainment gap. But does the Secretary agree with me that first, we need to see a national plan for social distancing and personal protective equipment, evidence of a sustained downward trend in cases, comprehensive access to testing for staff and pupils, a whole school strategy for when cases emerge, and protection for the vulnerable? Because in the words of the National Education Union, anything else will be a dereliction of duty from government.
Secretary of State.
I think the Honourable Lady would very much appreciate the fact that I would take my responsibilities to the safety and the health of children who attend school as the absolute principal motivation for everything I do as those who work in schools. And I'm always welcome to have constructive dialogue with her. That's why we've made every effort to do so in terms of how best we can support children to be in schools. And let's not forget, the overwhelming majority of schools, over 3/4 of schools, are currently operating in a safe, considered and proper way, supporting the children of critical workers as well as those children who are most vulnerable in society. And every step we take is about making sure that we look after those who are the most important part of our society, and that is our children, but also supporting those who work in those educational settings as well.
Secretary of State, substantive question, Henry Smith.
Schools remain open to children in care, and local authority virtual school heads actively tailoring their expert offer of advice and support to all children in terms of what they are learning in schools. For those not attending, we've made it clear to local authorities and schools that they should be doing everything they can do to maintain contact and support with children if they're not attending those schools.
Henry Smith.
Thank you, Mr. Speaker. What specific support during the COVID-19 pandemic is being provided for children in care and children with special educational needs, such as dyslexia?
We've actually been working right across the sector, making it absolutely clear we understanding the need for very specific, tailor-made guidance for a lot of children in special educational needs settings. We've been working with special schools in order to be able to provide that. We've also been providing tailored advice online and support and resources online for children with a whole spectrum and range of special educational needs, and how we support families in order to give education at home.
Can I welcome Tulip Sadiq to the front bench? Shadow D.
Thank you. Thank you, Mr. Speaker. Last week, the Children's Commissioner for England, Anne Longfield, said that the government's latest reduction in legal protections for children in care without proper scrutiny and an opportunity to scrutinise was not justified, given that the staffing in social care is holding up. The Labour Party agrees with the Children's Commissioner for England. Could I ask the Secretary of State if he also agrees with the Children's Commissioner for England?
So in terms of the regulations that we laid, we'd worked very closely with the ADCS, the Association of Directors of Children's Services, about how we make sure we do everything we can to maintain the very best support for all children when they're in care. And they'd asked specifically, and sort of the sector had asked specifically, to make sure there are some flexibilities that were made available to them. This is a temporary measure that we'd done in response to concerns that people had raised in terms of making sure that they're able to provide the best care for the most vulnerable children. And it is certainly not something that is going to be continued once we're through this crisis.
We now go over to the Chair of the Select Committee, Robert Halfon.
Thank you, Mr. Speaker. And will my right honourable friend first of all thank the teachers and support staff of Harlow who've been doing everything possible to teach children of critical workers and also vulnerable children over the past few weeks. Given that we know that only 5% of vulnerable children are being educated in schools, nearly 50% of under 16s are being potentially exposed to online harms, and possibly 2/3 are not accessing online education. Does my right honourable friend agree that a catch-up premium with tuition, mentoring and well-being will be necessary for these vulnerable children as schools begin to reopen once again?
Well, I'd certainly like to join my right honourable friend in paying tribute to the teachers and all those who work in schools in Harlow, but also right across the country for the amazing work that they are currently undertaking. In terms of the issue of how we ensure that every child in this country has the ability to catch up. This is something that we're working at very closely, and I was very interested to hear my right honourable friend's ideas, and we're looking at how we take some of those concepts, including the enormous goodwill that is held there by the British public to help support children to be able to make sure that they don't miss out as a result of this crisis, and how we make sure that this isn't just an idea but actually becomes a reality.
I will now call Minister Gillian Keegan to answer the substantive question that's been tabled by Steve Double. Minister Keegan.
Thank you, Mr. Speaker. T-levels are based on the best international examples of technical education, and crucially, they're employer designed. They will help to raise the quality and prestige of technical education across the UK with longer teaching hours and a meaningful industry placement. I am confident they will provide a high-quality alternative to A-levels, giving technical education the status and recognition it deserves.
Steve Double.
Thank you very much, Mr. Speaker, and I thank the Minister for that answers. Clearly, T-levels will have a valuable part to play in ensuring that we have the workforce of the future across our economy. But the sector of our economy being most adversely affected by the current crisis is the hospitality sector. And it is vital that this sector is able to access the workforce it needs for it to be able to recover, particularly in a post-Brexit world. So would the Minister please consider bringing forward a T-level in hospitality as soon as possible?
I agree with my honourable friend. Equipping people with the skills they need is crucial to our economic recovery, particularly in St Austell and Newquay. To support both tourism and hospitality, which I know are important to his constituency, we will offer T-levels in cultural heritage and visitor attractions, catering and management and administration. And with his support, I hope T-levels will be available soon so that young people in St Austell and Newquay can benefit from a high-quality technical education.
I will now call Minister Michelle Donlan to answer the substantive question tabled by Joanna Cherry. Minister.
Thank you, Mr. Speaker. I will take this opportunity to thank all staff in the FE and HE sector for their hard work in responding to this unprecedented challenge. I would like to reassure the House that we have protected grant funding to the FE sector for the full year and will provide additional targeted support. Yesterday, we announced a HE package of measures to boost support for students, stabilise the admission system and ease pressure on university finances.
Joanna Cherry.
Thank you, Mr. Speaker, and I thank the Minister for her answer. A survey by the National Union of Students has shown that 85% of working students will need additional financial support after losing their jobs as a result of the current crisis. With rent being the most significant financial demand on students, can the Minister tell us what discussions she has had with the private rental sector to ensure that students aren't being charged for rooms which are lying empty?
Minister.
Thank you, Mr. Speaker. We do understand that this is a difficult time for everyone, including supporting students. And that's why we've worked with the Office for Students to help provide providers with relocated funds towards our hardship funds for students, which is 46 million for April and May. In relation to accommodation specifically, we have sent a clear message that accommodation providers need to be fair and also be transparent in their policies towards students. There are additional packages which have been announced by the Treasury to protect renters who are tenants.
Now go across to Owen Thompson. Owen Thompson.
Thank you, Mr. Speaker. Researchers at Edinburgh University's world-leading Roslin Institute in my constituency are at the very heart of the global fight to find solutions for COVID-19, but higher education institutions like this are struggling to get the support they need through existing government schemes. Given the complexities of funding models for higher education and the immense impact of the lockdown on their current and future finances, will the UK government provide a support package specifically tailored for higher education sector jobs, support for the economy, support their COVID-19 fighting efforts, and what additional support is the Minister seeking to support research groups across the UK?
Thank you, Mr. Speaker. We should not underestimate the impact of the package that we announced yesterday, which builds on the Treasury announcement that universities are eligible for government financial support schemes worth at least 700 million. This package also brought forward 100 million of research funding, reprofiled tuition fees to bring forward 2.6 billion to help with cash flow, and most fundamentally, it is a package designed to stabilise the HE sector and safeguard it as a whole.
We go across to Carol Monaghan. Carol Monaghan.
Thank you, Mr. Speaker, and may I take this opportunity to welcome the new Labour front bench to their positions and also to pay tribute to all those working in the education sector to support our young people through this pandemic. Mr. Speaker, the £100 million of quality research funding that the Minister's just referred to is research for England. First of all, can the Minister confirm that this is indeed new funding and that these increases to the English QR grants will deliver Barnett consequentials for universities in Scotland?
Minister.
Thank you. I can confirm that this is QR funding that has been brought forward for English universities, but the Honourable Member will have noted in the announcement yesterday that it also included a research task force designed to prioritise safeguarding our research base. Now, that is a cross-governmental task force in which the devolved administration ministers will be having a seat.
I will now call Minister Vicky Ford to answer the substantive question tabled by Robert Koch. Minister Vicky Ford.
Thank you, Mr. Speaker. With permission, I'll answer questions 16, 17 and 18 together. We have two key priorities at this time: making sure that there's sufficient childcare for critical workers and vulnerable children, and also ensuring the longer-term sustainability of the vital early years sector. Therefore, the government will continue paying local authorities for the hours we normally fund, and where appropriate, providers can also access business rates relief and grants, a business interruption loan, and the self-employment support scheme, especially helpful for childminders. And in order to retain staff, providers can also furlough up to the proportion of their salary bill that would normally be considered as being paid from non-public funding sources.
To Robert Koch. Robert Koch.
Thank you, Mr. Speaker, and I thank the Minister for that answer. Well, with a young son at a local nursery and declaring that interest, I'm acutely aware of the pressures faced by earlier providers at the current time. And the government said it expects childcare providers and local authorities to work together to ensure sufficient childcare for children of critical workers and vulnerable children. But would the Minister also confirm that she will do everything in her power to support our vital early years providers, including meeting representatives to understand what more it might be possible for her department to do?
Minister.
Thank you, Mr. Speaker. Absolutely. My officials and I are in continual contact with early years sector organisations through regular meetings and working groups, and feeding their messages right into the heart of government. We've put £3.6 billion into the sector through funding the entitlements this year, and will continue to ensure that providers get the best possible support from the many different government schemes, whilst also staying within the rules. And Mr. Speaker, a new announcement for parents who are normally eligible for the government's free childcare will continue to be eligible for those entitlements during this summer term, even if their income levels have changed due to the virus. And this will be a massive support to families as well as to providers.
We now go over to Steve McCabe.
Good morning, Mr. Speaker. Mr. Speaker, nurseries and childcare providers have struggled to stay open during this crisis. And the Minister will know that the confusion over the DfE's statements on free entitlement and the furlough scheme has caused a lot of financial headaches. Last week, the First Secretary said at PMQs that if they were finding it too much to bear, we'll look afresh at what can be done. Can the Minister tell me when the Secretary of State will look afresh at what needs to be done? And given that she's regularly in touch with nurseries, will she tell me the last time she spoke to the nurseries and the childcare providers in my constituency, because they don't seem to know about plans to rescue their provision?
Thank you. I spoke to early years organisations only last week and continually speak to them on a weekly basis through my officials and meetings that I join regularly as well. In terms of the coronavirus job retention scheme, the initial guidelines were first published by government on the 26th of March. And I'm sure members understand that it would not be right for providers or indeed any business to receive two government incomes for the same costs. So we've worked closely with the sector to clarify this, and we will always make sure that early years providers get the best support possible. This will be an important discussion at the next spending.
So we will now go over to Barbara Keeley. Barbara Keeley.
Thank you, Mr. Speaker. Well, changing the guidance on the job retention scheme at the last minute has actually pulled the rug out from underneath many nurseries and childcare providers. And a survey by the Professional Association for Childcare and Early Years has found that 40% of childminders are not confident that their business will survive this crisis. Despite the answers that the Minister has given, there's a lot of confusion. Will the Minister do the right thing and bring forward a comprehensive plan to protect the childcare sector during this difficult time?
A brief answer from the Minister. Minister.
Thank you. The guidelines were first published on the 26th of March, and we will continue to work with the sector to provide clarity to make sure that they can access as far as possible every single set of government support together that is available at this time, and we will continue to work on supporting this vital sector.
We now come to questions to the Secretary of State for Health and Social Care. I first call Secretary Matt Hancock to answer the substantive question that's been tabled by Paul Bristow. I now call Secretary of State Hancock to answer the substantive question.
Thank you very much, Mr. Speaker. Mr. Speaker, we're providing up to £200 million to hospices over the next 3 months to support their work alongside the NHS as part of the national response by, for instance, providing spare bed capacity in community care to take pressure off hospitals, to support vulnerable patients and, of course, to support those in need of palliative care. And I'm sure that my honourable friend will be pleased to know that Sue Ryder, which runs one of his local hospices, has received £5.9 million in April.
We go to Paul Bristow. Paul Bristow.
Thank you, Mr. Speaker, and I would like to thank my right honourable friend for that answer. It is indeed great news that the government is providing £200 million for those nearing the end of their life. When does he expect hospices like Thorpe Hall to receive this funding? And in recognition of just how vital palliative care is, might we look to reform the way we commission palliative care when this crisis is over?
Thank you very much, Mr. Speaker. Well, there's lots of things that we need to learn when this crisis is over. The hospice system, of course, has always had a mixed model of funding, a very strong history of philanthropic support, as well, of course, as support and financial funding commissioned by the NHS for the services it provides to the NHS. The funding has started to flow. If there's a specific problem locally, I'd like to know, and then we can get to the bottom of it.
We have a substantive question from Robert Neal, Secretary of State.
Thank you very much, Mr. Speaker. We expanded testing to all symptomatic essential workers and members of their households last month, and as capacity continues to increase, we've been able to go further still with all those who have symptoms and who have to leave home to go to work, and members of their households now able to access a test, all part of the overall testing strategy, with the 100,000 tests that are now available.
Sir Robert Neal.
Thank you, Mr. Speaker. Testing to staff and residents of care homes in my constituency is being delivered either by referrals through the CQC or through the pilot partnership which has been set up between our Hospitals Trust and our Clinical Commissioning Group. In relation to CQC, will my right honourable friend examine why it is that test results are taking 5 to 7 days to come back rather than the estimated 72 days? And in relation to the pilot scheme, where tests are being delivered very efficiently, why it is that the care home managers are being told that the results of residents and the names of residents who test positive are given to them, but for data protection reasons, the names of staff who test positive are not being given to the managers of the home. That obviously creates uncertainty.
Secretary of State.
Thank you very much indeed. Well, I'm very glad to see the rollout of testing to care homes, and we're able to go further in terms of testing both for residents and staff in care homes. It's an incredibly important part of the response and one of the reasons why testing is so important. He raises two important issues of detail in the rollout, and I'll make sure they're looked into.
Shadow Secretary of State Jonathan Ashworth.
I'm grateful, Mr. Speaker. We need to be doing all we can to protect our key workers, especially healthcare workers. Now, I welcome and note what he said about testing, but I wonder if he's considered the study from Imperial that suggests weekly screening of healthcare workers, testing them every week, whether symptomatic or not, reduces their contribution to transmission by around 25% to 33%. So will he look at testing all healthcare staff, whether they've got symptoms or not?
Secretary of State.
Yes, Mr. Speaker. The Shadow Secretary of State has asked questions in a responsible and reasonable way, and I welcome his support for the test, track and trace pilot in the Isle of Wight that we announced yesterday. The question that he asked is quite right. We have piloted the testing of asymptomatic NHS staff now in 16 trusts across the country, and those pilots have been successful, and we'll be rolling it out further.
A substantive question, Mark Pritchard, Secretary of State.
Thank you very much again, Mr. Speaker. The development of a coronavirus vaccine is at early stages but progressing rapidly. The government has backed two promising vaccine candidates from the University of Oxford and from Imperial College, and we're making over 45 million available to those teams alongside the hundreds of millions we're making available to the global search to find a vaccine.
Supplementary, Mark Pritchard.
Thank you, Mr. Speaker. I'm grateful for the Secretary of State's response. On the issue of the World Health Organization, undoubtedly the WHO has made mistakes over COVID-19 and does need deep reforms. But is it not the case the global pandemic does require a global response? And can I ask the Health Minister how the UK is liaising with the WHO in order that we work together globally to beat this virus?
We do work globally, and we do work together, Mr. Speaker. As the Prime Minister made clear yesterday, we've committed £744 million for the global response to coronavirus. We are significant funders of the WHO, and I am grateful to them for their work. We're significant funders of CEPI, which is the globally leading search for a vaccine. In fact, we have the largest international contribution of any country in the world to the global search for a vaccine, and we have 3 of the top 10 vaccine candidates being developed here in the UK.
Substantive Laura Trott, Secretary of State.
Thank you very much, Mr. Speaker. We're developing a new test, track and trace programme to help to control the spread of COVID-19 and to be able to trace the virus better as it passes from people to people. This will bring together technology through an app and an extended web and phone-based contact tracing, and of course the testing that's needed to underpin it. The rollout has already started on the Isle of Wight, and I want to pay tribute to and thank the islanders of the Isle of Wight for the enthusiasm with which they've taken up this pilot, and I hope we learn a lot from the rollout across the Isle of Wight, and then we can take those learnings and roll out this programme across the whole country.
Laura Trott. Laura Trott.
Thank you, Mr. Speaker, and I thank the Secretary of State for his answer. I welcome the plans to introduce the contact tracing app, but for this to be effective, it will need to be rolled out to a large proportion of the population. What plans has the Secretary of State got to achieve that, and how is he going to alleviate privacy concerns?
Well, I'm grateful to that question. She's absolutely right that the more people who download the app, the more people will protect themselves, protect their families, protect their communities. I think that the cross-party support for this test, track and trace programme is important, and I think that right across this country people need to know that the app has privacy in its design. The data that it holds is held on your phone. It doesn't go to the government until, of course, you need to get a test, in which case, of course, you've got to get in contact with the NHS. So privacy is there by design. There's cross-party support. There's, according to a very early poll, 80% of people on the Isle of Wight want to download it. These are good early signs, and we'll have a big communications campaign to explain to people the benefits of the Test, Track and Trace programme as we roll it out across the country.
In welcoming Dr. Rosina Allen-Khan, can I say thank you for what you and all the staff do in the NHS saving lives. It is appreciated. Dr. Allen-Khan.
Thank you very much, Mr. Speaker. And if I may start by saying a huge thank you on behalf of us all in here today and all of those watching to our NHS and care staff who are working so hard on the front line. Frontline workers, like me, have had to watch families break into pieces as we deliver the very worst of news to them, that the ones they love most in this world have died. The testing strategy has been non-existent. Community testing was scrapped, mass testing was slow to roll out, and testing figures are now being manipulated. Does the Secretary of State commit to a minimum of 100,000 tests each day going forward? And does the Secretary of State acknowledge that many frontline workers feel that the government's lack of testing has cost lives and is responsible for many families being unnecessarily torn apart in grief?
Secretary of State. No, I don't, Mr. Speaker. I think that I welcome the Honourable Lady to her post as part of the Shadow Health team. I think she might do well to take a leaf out of the Shadow Secretary of State's book in terms of tone. I'm afraid what she said is not true. There's been a rapid acceleration in testing across over the last few months in this country, including getting to 100,000 tests a day. We've been entirely transparent on the way that has been measured throughout, and I have confidence that the rate will continue to rise. Currently, capacity is 108,000 a day. and we are working to build that higher. Now, of course, we've been working very hard to make the testing capacity grow as fast as possible, and as more tests are available, so we're able to make them available to more people and test people right across the NHS. I pay tribute to the work of NHS and social care staff on the front line. Nothing should take away from the team spirit with which we approach this.
We go across to the Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. And test, track and trace is only possible with a mass testing programme. And so many congratulations to the Health Secretary on achieving such a challenging expansion in our testing capacity. He's always said that he follows the science in the decisions he takes. But does he appreciate that Zoom or no Zoom, it is very difficult for us as MPs to scrutinise such decisions if he doesn't also publish the sage advice he receives at the same time as he makes those decisions?
Well, thank you very much, Mr. Speaker. We are making public the membership of SAGE and a lot of the science. I know that he also is able to scrutinise the scientists in front of the Health Select Committee, which he and his team did again this morning. I do think that the overall approach of transparency, which has been a lodestar of the government's response to this crisis, is important. There will be, of course, different scientists have different views and they make those plain. But we are guided, as he said, guided by the science in the decisions that we take, and I think that's been an important part of the response.
I will now call Minister Edward Agar to answer the substantive question that's been tabled by Richard Drax. Minister.
Thank you, Mr. Speaker. Public safety remains the government's top priority, and we have been clear that the NHS will get whatever funding it needs to respond to the coronavirus pandemic. As such, as a country, we have established a £14.5 billion coronavirus emergency response fund, with £6.6 billion going directly to the NHS. I know my honourable and gallant friend is a strong champion of community hospitals in his county. They are vital to our response to coronavirus and currently are managing well. I am not aware of any specific requests from his county. However, if further additional urgent funding is required, we will of course consider this.
Richard Drax.
Thank you, Mr. Speaker. And I'm most grateful to the Minister for his answer. And can I thank him and his team for the wonderful job they're doing. The main reason I asked this question, because Portland Community Hospital, the beds there had to move to Weymouth because of the shortage of trained staff. Can my honourable friend assure my constituents that we will fill the thousands of nurse vacancies, thereby allowing community hospitals like Portland to fulfil their proper function?
Minister.
Thank you, Mr. Speaker. Well, I would start, if I may, sir, by putting on record my thanks to our amazing NHS and social care workforce at this time. As my honourable and gallant friend is aware, the government is committed to growing and supporting the NHS workforce to ensure it continues to provide world-class health and care. We have set out our pledge that we will deliver 50,000 more nurses in our NHS by 2025, including through multiple work streams, including retention and recruitment. Many of these will operate in community hospitals, enabling them to continue providing that world-class care and support.
Now have a substantive question, Minister, from Ben Bradshaw.
Thank you, Mr. Speaker. The UK has confirmed that we will participate in the current joint EU procurement scheme on therapeutics for COVID-19 that is soon to launch. Owing to an initial communication problem, the UK did not receive an invitation in time to join in the previous 4 EU joint procurements. However, participating in those 4 initial joint procurement schemes would not have allowed us to do anything that we have not already been able to do for ourselves. We will consider participating in all other future schemes on a case-by-case basis and on the basis of public health requirements and needs.
Ben Bradshaw, going over to Ben Bradshaw.
Whatever mistakes made or opportunities missed in the past, on the day that the UK has overtaken Italy as the country with the worst death toll in Europe, what reassurance can the Minister give the public that decisions taken now and in future will be driven entirely by the public interest and not distorted by anti-European dogma?
Minister.
Thank you, Mr. Speaker. Well, I would gently say to the right honourable gentleman that there is no suggestion of any decision having been influenced in the way that he suggests. And indeed, the Permanent Under-Secretary of State to the Foreign Office made clear in his clarification to the committee this was not a political decision. I would reiterate to him what I have said, that we are open to participating in future schemes on the basis of public health requirements and on a case-by-case basis.
We now go across to the SNP spokesperson, Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. Operation Cygnus in October 2016 showed the UK would struggle in a pandemic due to a lack of both ventilators and personal protective equipment for staff. Why didn't the Secretary of State act on it?
Minister.
Thank you, Mr. Speaker. Well, I'm grateful to the honourable lady for her question. This government did act in looking at all previous modelling and all previous exercises. That is why the UK was well prepared. I take one example, ventilators, which she has mentioned. The UK has massively increased the number of ventilators available to our NHS, meaning that at no point thus far in this pandemic has there been a shortage of ventilators. I would equally reiterate to her that, going back to the original question, participating in those 4 initial joint procurement schemes with the EU would not have allowed us to do anything we have not already been able to do for ourselves.
I will now call Minister Joe Churchill to answer the substantive question tabled by Sir Edward Davey. Minister Churchill.
Thank you very much, Mr. Speaker, and I'd like to inform the House that we will be grouping 11, 12 and 13 together. I would firstly like to place on record my thanks to everyone on the front line, be they in a hospital, be they in social care, but also some of those less obvious places like my community nurses, pharmacists and others who are working ceaselessly on the front line. We are working round the clock to make sure that everyone across the NHS and care sector has the personal protective equipment that they need. To date, we've delivered more than 1.11 billion items of PPE. We're ensuring that PPE is delivered as quickly as possible to those on the front line. We've delivered to over 58,000 health and care organisations, and we are working closely with industry, social care providers, the NHS, NHS supply chain and the Army so that all our NHS and care staff can get the protection that they need.
Sir Ed Davey.
Thank you for that answer. But given how care homes have become a tragic focus of this pandemic, with so many staff and residents losing their lives, when will the Minister be able to guarantee that every care home will have all the PPE they need? And why is the Clipper system that's meant to supply PPE to the care sector now 1 month late?
Right honourable friend for his question. Every NHS and social care worker must have the protective equipment that they need. But turning to Clipper first, Clipper has been rolled out. It's important that Clipper actually is able to deliver the products that are ordered online. This is now being rolled out to more than 1,500 different general practices and care home providers. And as it is piloted and as it is stood up to more and more individual organisations, that will help ensure that that stream of work ensures that people have the personal protective equipment that they need. That is on top of the NSDR line where people can ring in case of emergency, but those are also backed up by the wholesale distributors, where only this last week 52 million more items were placed into that line as well.
Go across to Jacob Young. Jacob Young.
Thank you, Mr. Speaker. Across Roker and Cleveland, we have fantastic businesses like Pendraken Miniatures and BCFX who have switched their manufacturing lines to making visors. The Materials Processing Institute, who has switched to making hundreds of bottles of hand sanitizer for Marie Curie nurses every week, and 15-year-old Daniel Sillett, who is using his 3D printer to make PPE for local care facilities like Mask Hall. Will she join me in commending these businesses and individuals as part of our national effort in overcoming this crisis?
Thank you, Mr. Speaker. I would indeed like to join my honourable friend in congratulating him and for the way he's just explained that this is the most enormous national effort, from large-scale businesses down to those individuals like Daniel, to whom we must make a special thanks. This national effort and the way individuals and businesses have stepped forward, the many offers from all the different suppliers, has been extraordinary. We are working with industry partners across the piece to make PPE with INEOS and Diageo to produce hand and hygiene products and to make sure that we get these to the front line using services like Clipper. Thanks to the work we've already seen, we've seen novel products arrive on the front line. 7 companies have now been contracted in the UK to make over 25 million items of PPE and some 6 million square metres of fabric to the NHS supply.
Jonathan Gullis, going across to Jonathan Gullis.
Thank you, Mr. Speaker. And like my honourable friend from Redcar, I have Scrubs for Stoke and the Hayward Academy who have produced amazing amounts of PPE to our local healthcare sector. Can Mr. inform us what steps to take to ensure that community staff in care homes and domiciliary care in particular, from the country of kids talk and across the country, are receiving appropriate infection control training to ensure they're able to make optimal use of PPE and minimise transfer of infection from one client to the next?
The Minister could answer that.
Certainly. I would again like to pay tribute to businesses in his area, and I think the crux of his question was about people making sure that people are receiving the appropriate infection control training in order to utilise PPE effectively. We've published clear guidance, including videos, which are easier to watch and immediately understand the appropriate PPE for health and care workers based on clinical expertise. The guidance has been written and reviewed by all 4 UK public health bodies and informed by NHS infection prevention control experts and is consistent with World Health Organisation.
I think we're going to have to speed up the answer, unfortunately. I now welcome Liz Kendall in her new role. Liz Kendall.
Thank you, Mr. Speaker. I've listened carefully to the Minister's answers, but on the ground there are still serious problems. Maria, who's a care worker in the Northeast, told me on Friday she's only just received face masks and has to wear the same one throughout the day. Kenzie in Leeds told me exactly the same thing. One mask all day, even though one of the elderly ladies she cares for has coronavirus and can't help coughing and spitting on her mask. With almost 8,000 deaths in care homes so far, will the ministers tell us what changes she will make and what she will do differently to get a grip of this problem, which is still increasing, and help bring this terrible death rate down?
Minister.
I thank the Right Honourable Lady for her question. As I said, there are the 3 strands of guidance, making sure that the appropriate equipment is used in the appropriate place. We have also used the local resilience forums in order to ensure that individual care organisations can have a backup of personal preventative equipment so that people can use it in line with clinical guidance. I will contact the Honourable Lady after this because I would like to ensure that the young lady she spoke about has seen that guidance and the videos that accompany it in order to make sure that she feels properly protected, which is the aim of us that we're all working for.
Substantive question, Alex Shelbrooke. Minister.
Thank you, Mr. Speaker. NHS England and Improvement have published detailed guidance setting out the support for NHS dentistry during the pandemic. To minimise the spread of infection, routine dentistry is currently suspended. NHS practices are providing a telephone advice and triage on urgent dental centres to patients with urgent needs. NHS dentists will receive their usual remuneration in full or in part if they do part NHS, part private. Dentists can also seek help via all the Treasury means for lost earnings.
We go across supplementary. Alex Shelbrooke. Alex Shelbrooke.
Thank you, Mr. Speaker. My constituents in Elmet and Rothwell have reported difficulties in obtaining emergency dental care in Leeds. Can the Minister detail what actions her department is taking when the specific issue to say Leeds comes up so that patients can access emergency care during the lockdown?
Minister.
Thank you, Mr. Speaker. Of course, as of the week ending the 30th of April, there were 2 UDCs in the Leeds area providing urgent dental treatment and care to patients on referral from either a patient's own dentist or from referral from NHS 111. As with all urgent dental care centres, there is a referral service. The triage will give people either advice, antibiotics or painkillers, and then referred through if clinical work is required. There are 308 urgent dental centres open across the country. I regularly talk to both the Chief Dental Officer and the British Dental Association about the needs and requirements in the profession so we can care for patients best.
Minister, substantive question, Sarah Jones. Minister.
Thank you very much. It's vital we find out what groups are most at risk so we can help protect them. That is why we've asked Public Health England to conduct a rapid review of the different factors that might influence how someone is affected by the virus. Amongst other things, they will explore age, ethnicity and gender. As our Deputy CMO outlined yesterday, this is important but complex work.
Sarah Jones.
Thank you, Mr. Speaker. And I'm sure the Minister would want to join me in paying tribute to the staff at Croydon University Hospital and in our local community for the resilience and the bravery and the good grace they have shown during this crisis. Over 250 people have died in Croydon, and we are all thinking of their families and their loved ones who will be suffering so much. High levels of deaths in Croydon appear to be down to the underlying health of the population. Although, of course, it's early days in terms of analysing the data, it is clear that in Croydon, COVID has affected people from BAME backgrounds disproportionately. Does the Minister agree with me that on early sight, it looks like poorer people, and often from BAME backgrounds, are being hardest hit by COVID, and that we need to tackle the longer-term underlying health issues that have got us to this place of gross inequality?
Minister.
Thank you, Mr. Speaker. As I say, I think it's so important that we do the research before we draw the conclusions. Every death is a tragedy. Everybody who has died during this pandemic is somebody's mum, dad, brother, sister, and therefore we owe it to them to give Public Health England and all those researching into this area all the support we can so that we don't rush to conclusions, but that we draw conclusions that will truly help us address this pandemic and those who are most affected by it in the right way.
I'm sorry we didn't get more questions in, but maybe we can speed up the teams next time. We'll get through some more questions. We now come to the urgent question to the Secretary of State for Health and Social Care. I will follow the practice for substantive questions whereby I will call the Secretary of State to answer the question first. Before doing so, I have a short statement to make which is relevant to this urgent question. It's been widely reported that the Government will make a major announcement about the review of lockdown this Sunday. I consider this a matter of regret. It is important that the press is kept informed, but it is the duty of this House to hold the Government to account, not the media. Major Government's announcements should be made first in the House, and this is more important than ever during this time of crisis. I now call the Secretary of State to answer the urgent question from Jonathan Ashworth, as on the order paper. Secretary of State.
Thank you very much, Mr. Speaker. Mr. Speaker, we have flattened the curve of this epidemic, ensured that the NHS is not overwhelmed, and expanded testing capacity to over 100,000 tests a day. And Mr. Speaker, as a government, we are working resolutely to defeat the coronavirus. And there are two important areas where I want to update the House today. First, the expansion of our work to test, track and trace. We've now built a national testing infrastructure of scale, and because we have this extra capacity, we'll be delivering up to 30,000 tests a day to residents and staff in elderly care homes, making sure that symptomatic and asymptomatic staff and residents can all be tested. Our care system represents the best of us, supporting our loved ones with tenderness and dedication at their time of greatest need. And through this unprecedented expansion of testing, we can give them the certainty and confidence that high-quality testing can provide. Mr. Speaker, second, we're working to build the resilience of the NHS. We currently have 3,387 spare critical care beds in the NHS. And that is not including the capacity provided by our Nightingale hospitals, including the 460-bed Sunderland Nightingale, which opened earlier today. We should all be very proud that we've built up the NHS so fast and that our collective national effort has helped to protect the NHS and flatten the curve. As a result, we are now able to start to restore some NHS services, and we're in a position to be able to place the London Nightingale on standby. This is good news because our NHS has not been overwhelmed by this crisis and remains open to those who need care. And that means that this nation's shared sacrifice is having an impact. Throughout its time, Mr. Speaker, this chamber has borne witness to so much, and it's borne witness to the nation's resolve once more. And I'm delighted that the British people are well and truly rising to this incredibly difficult challenge.
I now call Jonathan Ashworth, who is asked to speak for no more than 2 minutes. Jonathan Ashworth.
Thank you, Mr. Speaker. Our thoughts, as always, are with the loved ones of those who have lost someone to this awful disease. And can we again pay tribute to our brave NHS and care staff? Can I say to the Secretary of State that clapping and campaigns for medals are appreciated, but does he agree that NHS and care workers deserve fair pay, mental health support and access to PPE? I'm hearing reports that we may have problems with the stocks of sterile gowns. Could he just update the House on that front, or write to me if he's not able to do so today? We also rely on international staff, as he knows. Will he scrap the health surcharge that they have to pay? It seems particularly unfair at the best of times, but especially at this time. We are tracking towards having one of the worst death rates in the world. We've seen the figures again today. I know he said we are through the peak, but can the same be said of the care sector, given the numbers of deaths we've seen in the care sector reported today? He knows we support lockdown, and it's right we engage in a debate about lockdown. The strategic aim must be to suppress this virus, not simply flatten its spread, in order to save lives and minimise harm. And testing, tracing and isolation is crucial. Does he agree that we should be mobilising our expertise in local authority public health services and other specialists like environmental health officers, and expertise indeed in primary care? Wouldn't that be a better route than outsourcing the call centre work to firms like Serco? We support digital tools, but he will understand there are questions around privacy. Could he undertake to publish a data protection impact assessment? As we heard in question time, deprived areas experience COVID mortality rates more than double those in less deprived areas. There are disproportionate mortality rates amongst Black, Asian and minority ethnic communities. Doesn't this show that COVID thrives on inequalities, and we need a funded strategy to support low-paid, deprived and marginalised communities, including enforcing protections in the workplace when we transition out of this lockdown? Can he comment on the remarks of the Chief Scientific Advisor at the Select Committee earlier, who said that we imported many cases from Italy and Spain early on in March? This was when, of course, events were going ahead like the Liverpool Atletico Madrid event. What advice will he be taking when we transition out of this lockdown as to ports of entry, testing at ports of entry and quarantine? And on a final point, Mr. Speaker, we are building up a huge backlog of unmet non-COVID clinical need in the NHS. What resources will be available to deal with that unmet clinical need, and how will we get these waiting lists down? Because we do not want to see excess mortality and morbidity because of the lockdown affecting those with non-COVID.
Secretary of State.
Thank you very much, Mr. Speaker, and I'm grateful to the Shadow Secretary of State for his questions. He's quite right to raise them. If I go through as fast as I can and respond to them in turn. First on gown supply. Gown supply is improving, and we have a better distribution system of PPE that we've been working incredibly hard on under the leadership of Paul Dighton, Lord Dighton, who has come in to help on PPE, and it made a significant improvement already. He asks about the number of deaths in the care sector. Now, of course, this is incredibly important to make sure that we protect those who live in social care, who receive social care in their own home. I'm glad that in the numbers released this morning, the data released by the Office for National Statistics, the number of deaths in care home is slightly lower, but it is still far too high, and there's a huge amount of work still to do. He rightly asks about making sure that we suppress the virus. This is the goal, not just to flatten the peak, but to get the numbers right down. And in doing so, our local authority, public and environmental health teams will be absolutely vital. He's right to draw attention to them. We often praise, rightly in this chamber, the NHS and social care staff, but I think this is a good moment for us to come together to praise our public health officials, our environmental health officials in local authorities. And then finally he asks about the non-COVID needs. These are incredibly important. People who need treatment should get that treatment, and we're opening up and reopening the NHS, including, Mr. Speaker, any temporary closures that may have taken place, for instance in A&Es, that need to reopen. And I can think of one example in Chorley, sir, which we're working hard to reopen as soon as possible as the NHS reopens, and I'm happy to put that on the record. It is slightly unfair sometimes that you as Speaker, sir, can't ask open constituency questions, but I know it's something you have worked incredibly hard on along with your colleagues in Lancashire. And finally, I want to really reiterate this point about levelling up. The government's agenda of levelling up is unabated. In fact, it is strengthened by this crisis. There are many reasons for the disparate impacts of coronavirus on different groups, and the Public Health England work that's urgently underway into, for instance, the impact on ethnic minority groups, on obesity, on in terms of deprivation, and of course the much greater impact on men rather than women. All these things need to be considered and looked into, and we need to level up our country once this crisis is over.
I welcome the comments from the Secretary of State, but we now go over to Sir Peter Bottomley. Sir Peter.
Can I ask if we can all recognise the loving care by social services staff and NHS staff, especially those who have to go on hot or cold visits to people's homes, the community nurses, the dementia nurses, the people with special needs, but also the GPs, paramedics. And can I ask the Secretary of State if you'll consider safer ways of those home visits, possibly using some of the offers of London black cabs, which have divisions between the driver and the clinician, and also much easier to clean down when necessary.
Secretary of State.
Yes, Mr. Speaker, I'm happy to look into all different ways of having safer working practices within the NHS and more broadly, of course. Within the NHS, infection control is a critical piece of work. And the point that the Honourable Gentleman raises, and is right to raise, is that this is not just a matter for acute hospitals. Of course, there it is mission critical, but it's a matter for all parts of the NHS, including, for instance, pharmacies, which increasingly have screens to make sure that there's a lower impact of transmission from customers to staff.
We now go across to the SNP spokesperson, Dr. Philippa Whitford, with 1 minute to place a question. Dr. Philippa Whitford.
Thank you very much, Mr. Speaker. At least 140 health and care staff in the UK have lost their lives to COVID-19, and we should pay tribute to them. But analysis of over 100 of these tragic deaths has highlighted that there weren't any among staff in critical care units, the most dangerous setting. So does the Secretary of State recognise this shows the effectiveness of full PPE? He claims to always follow scientific advice, but NerveTag, the Viral Threat Advisory Group, advised him last June to add gowns to the stockpile. So why didn't he do that? And why did Public Health England produce PPE guidelines for the whole UK that didn't recommend gowns for staff looking after COVID patients?
State.
Well, thank you. We do absolutely, we are absolutely guided by the science. It's a very important principle of our overall response. And hence we upgraded the PPE guidelines a few weeks ago to include the use of gowns. The guidance, of course, is always looked into as we learn more and more about this virus. And of course, the plans that we had were not plans for a particular virus, but for the threat of a pandemic. And then we've learnt more and more about this virus, which is novel and only came into being in December last year. Hence, as the science changes, so they update the scientific advice to ministers, and ministers update decisions.
We go across to Miriam Cates. Miriam Cates.
Thank you, Mr. Speaker. At the start of this pandemic, with no effective drug treatment, the only way to save the lives of coronavirus patients has been to make sure that hospital treatment is available for all who need it. So can I thank my right honourable friend for overseeing such a massive increase in critical care bed capacity. And we saw yesterday that NHS Nightingale in London isn't due to take any more patients. And while some have oddly criticised this announcement, does my right honourable friend agree with me that this should be viewed as nothing other than a success and shows how effective we've been in protecting our NHS?
State. Thank you, Mr. Speaker. Yes, I'm incredibly proud of the work that was done to put in place the Nightingale hospitals across the country. Most of them put in place in under 2 weeks. And the London Nightingale, which of course came in, was open first, is the prime example of the whole team, NHS, private sector, the armed forces, all pulling together. And it was a great accomplishment. But a greater accomplishment still is that it was never full, and that this country has managed to flatten the curve. And now that we're able to put it on standby, meaning that it'll be physically there in case there's a second spike, but as an insurance policy rather than as an active hospital, that is a very, very positive step which should be welcomed by all. I tend not to take much notice of some of the noises off which sometimes criticise me for not having full enough hospitals, sometimes criticise me for not having enough people wanting test capacity. Frankly, we'll get the capacity up and then hope we don't use it. That is the attitude we should take to the extra hospitals, and I pay tribute to everybody involved in the project.
Go across to Yvette Cooper. Yvette Cooper. We'll have to go across to Stuart Anderson. Stuart Anderson. Stuart Anderson, we've got it. Stuart Anderson.
Thank you, Mr. Speaker. We all know the importance of PPE during the outbreak and how difficult it is to get it and the great lengths you're going to procure it. On the weekly calls with New Cross Hospital and the City of Wolverhampton Council, the same point is at the forefront of our discussions, and it's the consistency of the PPE deliveries. Could my right honourable friend set out what plans he has in place to ensure that what is promised arrives?
Secretary of State.
Yes, my honourable friend's quite right to ask this important question, because getting the distribution of PPE to the front line is a critical part of it. It's been a huge operation. The head of the army has called it the largest logistical operation that this country has seen in 40 years. And it is a challenge one because there is a global shortage of supply. So we're working to get that supply as effective as possible. It's undoubtedly improving, but it's also, there's an awful lot of work still to do. Having the national shortage call centre and the phone line that anybody can call if there is a shortage coming up is an important part of the response. So too is the automated online deliveries for the smaller settings. But we continue day and night to try to do everything we can to improve the flow of PPE to the front line.
We go across to Vicky Foxcroft. Vicky Foxcroft.
Thank you, Mr. Speaker. Disabled people are worried about who's expected to provide PPE for personal carers. Many are finding it difficult to procure appropriate equipment, and when they can, they are finding that prices are inflated. Can the Minister outline what the government is doing to ensure that disabled people are not left without adequate equipment or out of pocket when attempting to protect themselves and their carers?
Secretary of State.
Well, she's quite right that making sure that our whole social care system gets access to PPE is important. There's often a focus on PPE in hospitals and in care homes, but also on home visits, as she quite rightly raises. The access to PPE is vital. There has been a global increase in prices of PPE. The prices that the government pays for PPE has increased a number of times over the course of this crisis. That is a feature of having a global shortage of supply as the demand for PPE across the world has shot up. We're seeing this the world over. What I hope to do is bring on stream more and more domestic manufacture of PPE, both to make sure you can get the quantity, but also to see if we can stop those price rises from happening.
Go across to David Johnston. David Johnston.
Thank you, Mr. Speaker. Elderly constituents of mine in Wantage and Didcot have been concerned by media reports suggesting they'll be forced to stay in their homes for an extended period of time. Can my right honourable friend confirm this is in fact not the case, and through all the work he's doing on testing and the tracking and tracing app, that he's working to make sure we can all return to a normal life as soon as possible?
Secretary of State.
Yes, I'd like to take this opportunity, and I'm grateful to my honourable friend for his question, just to set out the exact policy which has been got wrong by a few media outlets in the last few days. We set out from the start and clearly on the nhs.uk website that there are broadly three groups of people in terms of the strictures of the social distancing guidelines. There's people of working age who do not have underlying health conditions for whom we must follow the social distancing rules. There are those who are in groups who are, by the science, more susceptible to this disease, including the over 70s and some with underlying health conditions, for whom we say they are clinically vulnerable and must pay particular attention to the social distancing rules. Then there is the group that are shielded. In these cases, these are people who have specific underlying health conditions and will have received a letter from the NHS. It is only this last group that we have said, right from the start of social distancing, that they will need to stay away from people as much as is practically possible for 12 weeks. We know that this is a very significant impact and burden, and hence we've written individually to these people, and in many cases they'll have some specific requirements because of their condition. It's really important that people understand these three separate groups, and I hope that that clears up for the House some of the confusion which has been seen on the front pages of some of the newspapers.
Ruth Cadbury. We go across to Ruth Cadbury.
Thank you, Mr. Speaker. The Sunday Times this week had an extremely moving piece by photographer Stuart Franklin featuring NHS workers and patients fighting the coronavirus at West Middlesex Hospital, which is based in my constituency. Now, the article demonstrated very clearly the emotional impact of the virus on frontline health and care staff, as well as patients and their families. And we all know that post-traumatic stress syndrome will be a growing issue for many through and after this. So will the government invest in both immediate as well as long-term mental health treatment for all those affected? And will this take into account that many particularly health and care workers, are often reluctant to seek help?
Secretary of State.
Yes. The Honourable Lady makes an incredibly important point. I agree with every word of the question that she's asked. We are investing already in more support for the mental health of frontline workers, making sure that there are resources available to all. And of course, at the moment, there are challenges to delivering that because of social distancing, but I commit to continuing and strengthening that over the long term. It's something that I've thought as important throughout my time as Health Secretary. I pushed this agenda even before coronavirus, and now it's even more important, and I look forward to working with her on it.
Go across to Dean Russell. Dean Russell.
Thank you, Mr. Speaker. Across Watford as a volunteer, I've seen firsthand the many inspirational frontline workers, ranging from pharmacists to hospital volunteers, GP receptionists through to cleaners. So can the Secretary of State confirm that everyone on the front line will have the full support of government, so nobody is missed out who works on the front line as we continue our incredibly important fight against coronavirus.
Secretary of State.
Yes, Mr. Speaker, it's a big team effort and all play their part. And, you know, people have different roles, of course they do, and people have been incredibly flexible on the front line in terms of the roles that they play, but all play a critical part and all deserve our support.
We go across to Munira Wilson. Munira Wilson.
Thank you, Mr. Speaker. In order to test, trace and isolate to keep people safe and save lives, testing must work properly and be widely and locally available. So I was astonished to hear that yesterday, people in my constituency were being sent as far afield as Brighton, when we have a testing site right here at the RFU in Twickenham. Other key workers tested last week at Twickenham have had their tests lost and no one in the NHS can find them. And we are also hearing reports that people sent home testing kits have no return address to send their completed tests to, yet those tests are being counted. So will the Secretary of State please confirm, how are people being prioritised for testing at their local sites? How many tests have been lost at some of those drive-through sites and those that have been sent to people's homes? And when does he think that we will be doing enough testing to actually move to test, trace, isolate to keep people safe, like so many other countries have been successfully doing for several weeks now?
Secretary of State.
Thank you, Mr. Speaker. Well, we do have now one of the largest testing capabilities in the world. We're testing more people per day than Germany, and I think that the whole country should be reassured by that fact. And of course, there are individual examples of where the logistics go wrong. That's natural in any very, very large system. And I'm very, very interested if she could send me the details of those specifics, then we'll look into them. But what I would say is that the availability of testing now across the board is huge. It is big enough to start the Test, Trace and Track programme. We're piloting that, as she knows, in the Isle of Wight from today, and then we'll roll it out across the country.
We now go across to Dr. Luke Evans. Dr. Luke Evans.
Secretary of State, in one of your earlier answers, you very kindly went through the definitions of all the different vulnerabilities and groups that are out there. Definitions are really, really important, especially as we start to consider lockdown and indeed releasing it. When that point comes, will he be crystal clear on exactly who is entitled to do what and when, and make sure that everyone in the public knows exactly that?
Secretary of State.
Yes.
We now go across to Caroline Lucas. Caroline Lucas.
Thank you, Mr. Speaker. Can the Secretary of State confirm that directors of public health and environmental health officers won't just be consulted, but that they'll actually be leading the delivery of community tracking and tracing efforts, given that that's what they've been trained to do? And can he really reassure us that the government won't be repeating the mistakes it's made with drive-through testing centres and PPE supply by outsourcing those critical tasks to private companies like Serco, Sodexo and Deloitte, who frankly have simply proved that they are not up to the job?
Secretary of State.
Well, I agree with the first part of her question. She's completely wrong in the second part. The first part of the question asked whether the local public health officers and environmental health officers will be a critical part of Test, Track and Trace, and the answer is yes, they will, absolutely vital. The second part, she's completely wrong. There is no way that we could have delivered the testing programme without the unbelievable support, help and effort of private partners, both in the diagnostics industry and in delivery, companies like Deloitte and Boots, who delivered that amazing expansion of the drive-through centres in such a short period of time. I pay tribute, hand on heart, to the work of every single person in that programme, whether they worked in the private sector or the public sector, whether they worked in the NHS, in the department, for Boots, for Deloitte. And frankly, to try to divide people in that way, I think she's missed the tone of where the country is at that, right?
Felicity Buchan.
Thank you, Mr. Speaker. In order to get London back to work, we need safer public transport. Does my right honourable friend agree with me that the Mayor of London needs to provide more tube trains to provide a safer service for Londoners?
Secretary of State.
Yes, I do, because the more people are spaced out on public transport, in terms of the distance between them, the safer that public transport will be. And I think the Mayor of London, I hope the Mayor of London is working extremely hard to have as full a service as possible so that as few people as possible can be on each individual service.
We go across to Ben Lake. Ben Lake.
Mr. Speaker, widespread testing and contact tracing will be essential to contain future outbreaks, and such a system will need to be operational before we move from full lockdown. Now, in addition to the Isle of Wight trial, will the Secretary of State consider the work being undertaken by Ceredigion County Council in collaboration with Hywel Dda University Health Board and Aberystwyth University on a community testing and contact tracing system that could offer local solutions and expertise to complement any UK-wide infrastructure?
Secretary of State.
Well, I'm happy to look at any examples that are effective of reducing the spread of the virus. Of course, parts of this are devolved, parts of it are the UK government's responsibility, and we've made available all of the tools that we're developing at a UK level for devolved governments to pick up. For instance, we've published the underlying source code behind the app so that people can have a look at it and suggest improvements or take it and use it in their own way.
We go across to Nigel Mills. Nigel Mills.
Thank you. Many of my constituents with cancer understood when their treatment was deferred, but are now keen to resume it, but nervous about going to hospital in case they catch coronavirus. Can he assure them that their treatments will resume and it is safe for them to go to hospital to have them?
Secretary of State.
Yes, I want cancer treatments to resume as soon as is safely possible. Now, in some cases, it is clinically not advised to resume treatments because there is the spread of the virus about in the community. For instance, treatments that reduce immunity to very low levels. But there's other areas, for instance, some of the surgery that we are able to restart. It's a very, very important part of the restart of the NHS. And the message I'd give to my honourable friends constituents is that if you are advised by your doctor to go to hospital, then you should go to hospital, because they will have taken into account all of the different risks and decided that that is the best advice to give. So if you're asked to go to hospital by your clinician, please do go.
We go across to Catherine McKinnell. Catherine McKinnell.
Thank you. The government chief scientific advisor said that if we can keep deaths below 20,000, we will have done well in this epidemic, yet the death toll now stands at a devastating 32,313. And it's not about whether we can use international comparisons. This is the government's own measure.